My name is Brianna Nachude. I work with Kampala Audiology and Speech Center as their assistant audiologist. Today we are switching on one of our patients who underwent a surgery, a cochlear implant surgery last month, and today we are switching her on. The switch on is not switching on lights like you go in a house and switch on the lights. When we do the surgery, we have to give the child a grace period to rest. One, to heal, and another thing is not to introduce electricity immediately into her body. So we give her time to heal, and when the child heals, that's when we do the switch on. Immediately after the surgery, the person is not yet hearing. The person starts hearing and hearing environmental sound on the day of the switch on. So when you come and we've done the surgery and it is done, we then have to perform another procedure which involves us programming what we call a processor. And that processor is usually outside of the head. So when we program the processor, it's basically to connect the electrodes that were put into you with the outside environment. So when sound comes, it goes into the processor first, and then it is transmitted to the electrodes, which then take the information to the brain. After you place the processor on the child, some children will smile, other children will cry. Some, as an adult, they'll be amazed they are hearing sound for the maybe second time when their hearing stopped. But mainly children, most times they cry because they are not used to the sound. They are used to a quiet sound, and then now they are hearing a lot of things are happening. Maybe people are walking and they're hearing, oh, people actually make sound when they walk. The wind is blowing and they're hearing all that. So they get excited and some of them cry. Some children turn when every sound they hear, they keep on turning. They keep on wanting to go there and see which sound is that. Some children are curious. So we expect all those experiences when we do the switch on.
I held Daddy's hand. We saw some children. The children were splashing. Daddy put on my armbands. A lady splashed with her legs. I didn't like.
If you feel your child is around 8 months, 6 months, they are not responding to sound. When they are sleeping and you move into the room, they do not make any reactions. They don't turn, they don't try to wake up, they don't pay attention to you. Even when you call them by name, they can't hear you. If you feel your child was given any sort of medication that is ototoxic, and you feel there is need for a checkup, there is need to have a test done, please just pass by Kampala Audiology and let's have these tests done for these children, because the possibility of a child being able to hear again is there, and it is possible. A child can be able to hear again if they were born hearing and now they stopped hearing all of a sudden, or if they were not born hearing due to different circumstances. Mother might have gotten rubella, mother might have gotten malaria and was treated with quinine. So many things can happen during pregnancy and after pregnancy. Solutions are there. We can help. We can lay a helping hand, and you can come to Kampala Audiology, have your tests done. We walk with you through the whole process. We walk with you from the day we discover that the child cannot hear up to the day the child is old enough to take care of their own implant, to take care of their own processor. But we walk with you. We direct you, we tell you what to do, what tests to perform. We organize the doctors for you, we organize the hospital for you, we do the switch on here. So it's a simple process now. Things have been brought closer to us. Back then, people would fly and go to India, to the UK, to the US to have these surgeries done. But we've brought the services closer, and it's much, much cheaper.